If you've struggled with contact lenses in the past, this episode of OcuTalk is perfect for you. Today, we're talking with Dr. Caitlin Morrison about the benefits of scleral lenses and the new innovations we can look forward to this coming year. Dr. Morrison?
I want to talk to you.
Not now, later.
No, now.
All right, so hello everyone. Thank you for joining us on this brand new episode of OcuTalk. My name is Nick, and today we have a very special guest coming out to you from In Focus in Scottsdale, Arizona, Dr. Caitlin Morrison. Dr. Morrison, thank you so much for joining us today.
Thank you so much for having me.
Absolutely. Glad you're here. I would like to get started right away if we could. I know your specialty is in contact lenses, and I was hoping that maybe you can explain to our viewers what scleral lenses are.
Yeah, so scleral lenses are a unique type of lens. They're actually not called a contact lens because they don't make contact with the cornea. They're a large diameter, rigid lens, which means that they're made out of a hard material as opposed to a soft material. And you fill them up with saline before placing them on the eye. So it can be a really great treatment for people who haven't found success with other types of contact lenses like soft lenses. And it can be a really great treatment for people who have really severe dry eye.
Perfect. I mean, that's great. That's great to hear. What are the benefits of scleral lenses?
Scleral lenses have a lot of benefits. So what we use them for in clinic mainly is patients who have not found success with traditional glasses or soft contact lenses, or even other types of rigid contact lenses where they might be uncomfortable. And what these can do is they essentially create a new ocular surface for you. So the front of the eye, if it's damaged from a condition like keratoconus, corneal transplants, radial keratotomy, different things like that, you can actually rehabilitate and provide a new, better surface for that eye with the scleral lenses. They're also a really great treatment opportunity, as I said before, for dryness. And in really severe cases, Sjogren's syndrome, Stevens-Johnson syndrome, and a condition called graft versus host disease, the front surface of the eye is really damaged from just basically insult and this condition, injury. And you can rehab the eye and actually heal the front surface of the eye with these lenses.
Very interesting. Very good to hear. With scleral lenses, is there a certain patient that you would recommend scleral lenses for?
Yeah, so like I said before, anybody who feels like they're not really seeing their best, but in the majority of patients that we see have some sort of condition. They've had radial keratotomy surgery, LASIK surgery in the past. Maybe they have keratoconus, corneal transplants. A lot of patients come in with corneal scarring, where they obtained an injury and then they can't see as well out of that eye. They think there's nothing that they can do, and then they try the scleral lenses, and we can get them from 2100 vision to 20/20 vision, which is pretty remarkable.
Wow, that is very remarkable.
Yeah. Yeah, that's the main patient I would recommend. But again, like anybody who just feels like they aren't seeing their best, because I do have patients as well who have come to me and we call them 20/20 unhappy. So they're seeing 20/20, but they're still not happy with the clarity, and we can improve on that clarity with these lenses.
Wow, 20/20 unhappy with 20/20. I would never know that. That's pretty amazing. What are the new innovations going on with scleral lenses that we can look forward to in the future?
Yeah, scleral lenses are great, but they've come a long, long way, even in the past 5 or so years. The newest technology that we have is basically one that improves both the comfort and potentially the vision in all of our scleral lens patients. Basically, we have two things that are out right now. We have a scan-based fitting technique and a mold-based fitting technique, where instead of putting a lens on the eye and seeing how it's functioning and making some changes, what we do is we take scans of the eyes with a special machine. We can take a mold of the eye, like a physical mold. We put some material inside the eye and then take it out. And through those techniques, you actually put that design into CAD software, design the lens on software, and it fits the patient much more perfectly. It decreases a lot of what's called fogging throughout the day, where you can get like a little bit blurry throughout the day with your lenses. And it can just improve upon people's vision because of the way that the optics are made. So really cool innovations. There's also another innovation that came out where you can take people who, even with scleral lenses, even with like special lenses in general, if they're not seeing their best, you can put what's called wavefront aberrometry or wavefront optics on the front surface of these lenses and increase the vision even more. So really cool stuff that's coming out.
Definitely really cool stuff that's coming out right now. Is there anything else that you would like to tell our viewers that's going on with you or scleral lenses in general? Anything else that you'd like to tell them?
Yeah, I think just in general, there's new technology coming out basically every 6 months, every year, that improves upon the quality of life for people with eye conditions. So if you've been told in the past that things won't work for you, or if you're, again, really unhappy with your vision, there's nothing wrong with getting a consult just to see if maybe something is out there now that might work for you that didn't work in the past.
Perfect. Dr. Morrison, thank you so much for joining us today and taking the time just to explain to our viewers about scleral lenses.
All right. Thank you so much. Thanks for having me.